filming. Right, Charlotte, can you tell me the sport that you play?
I'm a rower. For rowing.
Okay. Can you tell me a component of health-related fitness that you think is important for rowing?
I think muscular endurance is one of the components that's most important in rowing.
Okay. Can you justify why that you feel that's really important?
Quite often it's long races, and therefore it's for an extended period of time. You're reusing the same muscles over and over again for a repeated and prolonged amount of time, and therefore muscular endurance is a really important component.
Okay. Why do you feel that muscular endurance might be more important than strength?
Strength would be more if it was a one-off or something like that, whereas your endurance is for a longer amount of time, and with the nature of the activity, it's the same muscles over and over again. Therefore, the endurance is a lot more important than having the strength to just do it over a shorter period of time.
Fantastic. If I was to ask you then, which component of fitness do you think is least important for rowing? Health related again, please.
Okay, probably something like flexibility. You don't really need to be that flexible in order to row, because again, it's similar movements over and over again. Nothing really over the top needed in terms of flexibility, and therefore probably the least important of the health components of fitness.
Okay. We've said that muscular endurance is really important then. Can you tell me what test you would use for that component of fitness?
I would use for muscular endurance the Harvard step test. Particularly important as it's specific to rowing, as it is testing the muscular endurance of the leg muscles.
Okay. Is there any reliability and validity factors that you need to consider when testing?
You need to consider the height of the step, timing, so when you're doing the test, are you timing for the correct amount of time? Measuring your heart rate, is it accurate? And when you retest, you need to make sure you're following the same procedure every single time.
Okay. If you were to work on your muscular endurance, what type of training would you use and why?
For rowing, I would use continuous training. One, because it helps with your muscular endurance, so it helps develop that component of fitness, because again it's for a prolonged period of time, and two, because it is similar to the nature of the activity of rowing, and therefore you're making it specific to your sport.
Okay. If I was to undergo some continuous training for rowing, can you tell me some of the short-term effects that I would have on the different body systems?
Yep, you'd have an increase in heart rate on the circulatory system, you'd increase in blood pressure. For your muscles, you'll have an increase in blood flow to the muscles.
Which will cause an increase in...
You'll have an increase in, have I said breathing rate?
No.
No,
Yeah,
increase
it's
in
a
breathing
respiratory.
rate, an increase in your tidal volume and stroke volume and cardiac output.
Okay.
That's what else.
That's good. You've discussed quite a lot there. I should have probably broken it into the 4 different body systems for you. If we stick with the cardiovascular respiratory system, those two, can you tell me what those changes will have, how they impact your performance?
Long term.
Short term.
Short term.
So how will the changes improve your performance as a rower?
All right, okay. So your increase in breathing rate means that you're getting more oxygen in, which will mean that you can work aerobically for a longer period of time. Then your increase in your heart rate means more blood is getting distributed around the body, therefore more oxygen is getting to your muscles, and again that will help you work for a longer period of time.
Okay, fantastic. If I was to talk to you about training thresholds and use the word aerobic and anaerobic, could you just discuss what threshold do you think you'd be working at?
Particularly if you were continuous training and things like that, you would mostly be in your aerobic threshold. So that's with oxygen, because it's for a prolonged period of time. Towards the end of a session or at the end of a race in rowing, you would definitely be working anaerobically, because it's a bit more of a sprint finish, it's shorter, you're not using oxygen when you're respiring in your muscles. Fantastic.
If we were talking a bit more long term now, if you were going to improve your method of fitness over 6 weeks, how would you do that?
If I was going to improve my method.
So your
Right,
muscular
so
endurance over 6 weeks.
All right, okay. So I would apply the principles of training to my training methods. So I would have an increase in frequency. So I'd increase how many times I'm training a week. I would increase the intensity of my training sessions. So I might work at 60% of my heart rate. The next week I might do 65% and just slowly increase my intensity. Hopefully, my heart rate will drop anyway, and therefore I won't have to go as hard to get my heart rate as high. So keep moving that threshold up. I would also sometimes extend the amount of time that I'm training for, so gradually increase how long I'm doing my continuous training for. And finally, I would change the type of training I'm doing. Sometimes it would be boring if I did continuous training, especially in rowing, where it's the same action over and over again for all the time, so I'd perhaps do circuit training instead.
Fantastic. You've covered the whole of fit there, and very well, I might add. If we're looking at ice sport, then how would you apply those principles to your training as a rower?
Okay, I'd have to identify my individual needs. I'd need to know where my weaknesses and strengths lie. From that, I'd try and make my training specific to me and to my sport. So if I was doing, for example, circuit training, making the activities specific to, for example, muscular endurance, and make them specific to rowing. So particularly focus on leg muscles and things like that. I'd progressively overload through the fit principle. So like I've just said, gradually increase my training and make it harder to push myself. And finally, I'd need to think about having some rest and recovery, so making sure on occasion I've got a rest day, so that allows my body to recover and gain from the training that I've just done.
Super. Okay, so we've done our 6-week training programme. We talked before about the short-term effects on the body systems. I'm going to break it down a little bit more this time. So can you just tell me what long-term effects you would expect to have on the skeletal and the muscular system?
Okay, an increase in bone density on your skeletal system, an increase in bone strength, therefore. Muscular was the other one?
Yeah, muscular system.
Muscular hypertrophy, so muscle growth, increase in capillarization in the muscles. I suppose that would be a little bit of circulation. And an increased resistance to lactic acid.
Okay, and how would that help your performance as a rower?
You'd be able to go for more time because you've got better blood supply to your muscles. You've got bigger muscles, and therefore you should be stronger and have greater endurance and things like that.
Okay. And if we then look at the cardiorespiratory system, so look at the long-term effects on those two.
So you'd have a decrease in your resting heart rate, an increase in your cardiac output, increase in your stroke volume. Spiritually, you'd have an increase in your tile volume, hopefully, better capillarization in your lungs and in your muscles, like I've just said, an increase in the oxygen diffusion rate across the lungs and the muscles. Do I need to say how that will improve my performance? Next question. Yeah.
Go on, the next.
Next
just
one.
Explain how that would help your overall performance then.
Okay, so overall your body will be a cope better with the demands of exercise. So with an increase in your capillarization, for example, you're getting the oxygen across quicker, which makes it easier for you to perform for a longer period of time.
Okay, you said you'd have an increase in stroke volume. So what's causing that, and an increase in resting heart rate? So can you just explain that a little bit further?
Yeah. So you've got cardiac hypertrophy occurring. So my heart muscle is stronger and bigger. Therefore, per beat or per pump, it can pump out more blood, and therefore it doesn't need to work as hard in order to get the same amount that it used to before. That causes you a decrease in resting heart rate, and during exercise, and normally an increase in your stroke volume, which means that it doesn't need to beat as many times.
Excellent. I think you've passed your GCSE.
Thanks.